Hi, everybody. My name is Justin Brinkley, and I want to talk to you for a few minutes about stroke. So, I'm sorry this is getting turned in as late as it is, and maybe it's not as exciting a video as it should be. Um, I've unfortunately had COVID, and my cat is fighting with my dog. Anyway, uh, I've had COVID. It's been all I could do to sit upright for long enough to record this. Then I lost my voice and blah blah blah. Anyway, I'm feeling a little bit better, and so here I am. So to talk about stroke, what is a stroke? Well, um, a stroke essentially is a blockage in the blood flow to a part of the brain. You think of it as the same thing as like a heart attack. A heart attack is a blockage to the blood flow to part of the heart, or pulmonary embolism blocks part of the lung. A stroke is similar. Usually, in most cases, the lining of the blood vessels gets thicker over time due to high cholesterol and things like that, and you end up developing a clot. And that goes flying around your body, and if you're lucky, it dissolves and goes away. If you're not, then you end up with one of those things. If it ends up in your brain and sticks somewhere, then you'll have a stroke. Your symptoms will depend on what part of the brain is affected. It could be your speech, could be motor function, something like facial droop. You see someone, facial droop, or weakness on one side of the body, the inability to make words or understand words, things like that. Uh, it varies widely. It could even be behavior if it hits up in the frontal lobes of the brain. Like I said, most common though, it comes from high cholesterol or smoking, causing thickening and hardening of the lining of the vessels. You end up getting a clot off of that. That breaks free. Often it can also be because you've had an embolism from having a surgery or like a hip fracture, or it could come from having a heart arrhythmia like AFib. Um, so a lot of times we have patients come up to the hospitals to the neurology unit, and we are in the heart center, and they get confused. They say, "Why are we in the heart center? I've got something wrong with my brain." And well, yeah, it's true, but they are related. All of the body systems are related, but a lot of times it can be a problem with your heart uh, that causes the stroke. That's why we will always, if we have a patient come in with a stroke, um, monitor their heart rhythms for a day or two, looking for atrial fibrillation. Um, anyway, if you have a stroke, the important thing is to get to the hospital. If you can get to the hospital within 4 hours, the gold standard treatment for a stroke is TPA, and I can never remember. See, it's a recumbent tissue plasminogen activator (TPA) or Altipase Activase. It's basically just a real strong clot buster, and you get that IV, goes in, basically just blows up all the clots in your body. Problem with that is it's dangerous. You run a really high risk for bleeding if you get TPA. So you have to be watched in an ICU on bed rest for 24 hours at least after you get TPA. It's also important, like I said, that you get to the hospital within 4 hours to get it, because if you're after 4 hours, well, the damage has been done. The risks of bleeding from the TPA don't outweigh the benefits of possibly getting rid of the clot. Time is tissue, so the quicker you can get treatment, the better. If you wait too long, then you basically are just looking at treatment options for prevention, keeping it from happening again or getting worse. Those treatments include things like daily blood thinners like aspirin and Plavix, and taking cholesterol medications like Lipitor or Crestor, to try to prevent strokes from happening again in the future. You also want to watch your blood pressure really closely. Um, An interesting thing with strokes on the subject of blood pressure that run into a lot with patients. They'll come in and they're surprised that whenever they initially have a stroke for a day or two, we want their blood pressure to be therapeutically high. So people will have really elevated blood pressures, and they're surprised that we're not doing anything about it. And I like to explain it as if you think of your blood vessels like a water hose, the water hose is flowing normally. Well, if it's got a blockage, uh, part of the flow is pinched off, and so that flow that's pinched off is what's causing your stroke symptoms. Well, if you can keep your pressure high, if you think of it as like putting your thumb on the end of a blood pressure on the end of a water hose, it sprays faster, it sprays more. So if you can keep your pressure high, it'll keep that vessel open and get more blood flow through to your brain. Whereas if your blood pressure drops too low, that vessel will shrink and then can potentially pinch off, and you can lose more function, cause more damage than you would have before. If we can keep the blood pressure high for a little bit, sometimes that can mitigate some of the damage that would occur from the stroke. What else? Whenever you first come in for a stroke, the scans that are always done is a CT scan to make sure what kind of stroke it is. If you have a bleed, you obviously can't get TPA because that'll just get worse. If you don't see anything on the CT, they'll usually do CT perfusion studies or a CTA to look at your blood flow in your brain and see if they can see a stroke. A lot of times the CT just won't show anything if you've had an ischemic stroke, and that's at least early. It takes a few days. In that case, if your symptoms are still there, then they assume you've had a stroke, and then we move on to the next step, which would be TPA, or if it's too late, then just monitoring and prevention, trying to figure out what caused it and keep it from happening again. Anyway, the important thing, and probably the most important thing to teach patients and family members and the general public anyways, how to recognize a stroke and to do something quickly. They get to the hospital, grandma's had these symptoms for 2-3 days. She tried to sleep them off. Now do something about it. Why aren't you doing anything about it? Well, you've got to act fast. If you notice these symptoms, you've got to get to the hospital fast. And that's why the acronym that they use to teach people is FAST, F-A-S-T. Stands for FACE, for like facial droop or facial abnormalities. A for arm, or so like if you think of a limb weakness, arm weakness. S for speech problems, slurring, stuttering, any kind of speech problems, or and T, which stands for time. So it means it's time to call 911. So teach your family, teach your friends. If you notice anything weird like that, don't wait, because if you wait, then you won't be able to treat it properly. If you go fast, get to the hospital, you can take care of it. Potentially having a stroke, if you can do TPA, a lot of times you can get rid of almost all of the symptoms. Otherwise, you're stuck looking at a long-term therapy. Hey, animals, here they all are. Long-term therapy to hopefully get back some of your function. A lot of patients do get back a lot of their function with long-term physical and occupational therapy, speech therapy, but not always. So again, it's important to act fast. And so since my family is deciding to climb on top of me, then I guess I'll go ahead and use that as a signal to sign off. Again, I apologize for this being so late, but I appreciate it. Thank you very much.